It's a privilege to be selected. This process is peer nominated and it recognizes the top 7% of physicians in the nation. So honestly, among so many outstanding peers that I have, it's an honor to be selected. Of course, I've worked side by side with my peers from medical school through residency, through surgical training, and I know everyone's commitment to excellence and outstanding surgical outcomes. So to be selected amongst my peers is really special. The fact that they chose me amongst all the surgeons that we have in our field really makes me feel like the work I'm doing is making an impact, and I'm so grateful. I always aspired to be a physician, even when I was younger. I remember doing like an elementary school project on my pediatrician, and so I always wanted to be a physician to help people and use my knowledge of science, as kind of a resource for my patients. It was later in medical school and even later in head and neck training that I decided to pursue facial plastic surgery. There's not a lot of women in this field, so as a female who's very oriented in beauty, I really love that my patients find me for my unique aesthetic, and I love sharing with them and being part of their journey. They're generally happy and healthy patients, and so being able to help them feel more confident and love how they look is really something that I love to do. I really found that my patients who come to find me have a lot of education and they want to be really aware of their options. So through the different outlets like social media, they're able to get some of the information about cosmetic options surgically and non-surgically, and they ask really astute questions. So I think information and education is becoming really important in this field and in all the fields in healthcare, and patients want to be involved in the process. I think it really starts with the team that you put in place from the first moment that the patient calls and who answers the phone, from walking them into the consultation room. I think that having a team that's in place that's treating your patients with utmost respect and care and really being there for them is so important, because a lot of these patients are doing procedures in our field of facial plastic surgery that they're nervous about, that their family members are nervous about. So making sure that the whole experience for them is reassuring and helps them get to the finish line in their journey. So we've started to get access to AI for note taking, and really it improves efficiency. I myself was a scribe before medical school, and so the training process of learning the material as a scribe, someone who's not in medicine, that's what we're using right now. So having AI kind of step into the field with more educational background than someone who's a novice in the field may be able to expedite that efficiency, help the doctors see the patients better, and then get more accurate notes for the patients. There are no shortcuts in medicine. You have to study really hard, and I think the most important thing is having a good support system in place. The journey is really long and it's tough at times, so making sure that you have that support that can help you get to the finish line is really important.